But I think at heart, even though I've been a physician for a number of years, I'm truly a social worker. So the idea of being a member of a board where instead of having to raise money all the time, we actually gave money was thrilling. Especially to give money to very, very worthy causes. Absolutely. There have been several organizations throughout the years that I've been here that have just been astounding in their ability not only to service people who don't get health care otherwise, but to build models that are flexible with our changing times. It is really interesting because, you know, this is a business, but it's so exciting because it was set up different from any other business I've ever been involved in. You know, in the very beginning, it was just a small cadre of physicians that wanted to make healthcare better. And they decided then that they would dedicate themselves to that mission. And that's grown with the times and been flexible with the times too. But they always said we wanted it to be a nonprofit. And let's take our profits and let's put it in a foundation that is, the mission is to do good.
Yeah.
To put these dollars back into areas that people are not serviced. Our basic principle is to fund organizations that provide care for people who don't otherwise get health care.
Okay.
Number two, we don't want them promoting their own agenda, if that makes sense.
Yeah. Uh-huh.
Like we wouldn't fund organizations that are so politically stringent that
I see, yeah.
you know, we really try to look at people that are doing good work with people, and our dollars go directly to those people and providing health care services.
Is there a local example of that? Is there?
Yes, there is a real good local example. I know you'll know about Channel Markers.
Yeah. Well,
You know, a wonderful organization. And we've funded them now. I think this may be our third or fourth year. They came to us with a program that said we've got 120 people living in the community that are doing fairly well except for their health care. They don't go to the doctors, they go to the emergency room. They don't know how to take their medicine. They don't know what to do to get their physical health good. We bring them in for counseling, but their physical health, now they're getting older and it's going to pot. They have diabetes, they have heart disease, and they don't know how to do anything. So we want to do a home program. We want to hire a nurse. We want to send that nurse out to them. We want to make sure that they know what their medicines are, know when their doctor's appointment is, make sure they have transportation. I like to think of these organizations as the true trenchmen. I mean, they are out there on the front line. They are dealing, like with the example of Channel Markers, they are dealing with the hardest patient population that there is to deal with. And if we can look at them and examine what they're doing right and how they're doing right, how are they reaching people, how are they talking to people, what time are they spending with people to really make them understand what differences are they making, I think we can translate some of what they're doing to the entire system. If we could make a simple change, if I could give you a simple example, we fund several organizations that are dentistry foundations. We do one that's called the Maryland Foundation of Dentistry for the Handicapped. That's a mouthful. But what they do is they go through the state and they get volunteer dentists, volunteer labs to give free dental care to people. They have a waiting list of over 700 people. And they keep chopping away at this. Where this is important is there's really nothing in the healthcare system that truly covers dental care for people. Medicare doesn't, Medicaid doesn't, and there's more and more research showing that bad teeth causes internal problems. You know, so if we're not addressing this, we're going to have a whole population of people that are going to be a real burden to the healthcare system just because your teeth aren't clean.
Yeah.
I think we're a good prototype of a true business that makes money and gives back. And that is something I think is really important for this community to know. We're not just here to put dollars in CEOs' pockets. We're
Yeah.
here to actually service the community, which is a rare beast